I also would love to focus on vulval lichen sclerosis and why it's often missed in women of color.
Yeah, I mean, I can start with the lichen sclerosis because
Sure.
obviously, I think that that is a very underdiagnosed condition in women of color. And because, when you learn about lichen, if you look at like the atlases of dermatologic skin conditions of the vulva, many times it's really just you looking at how the architectural changes happen in the vulva, the hypopigmentation, the maybe the thickening of the skin, all of
So
the
what
stuff.
is it? What is it exactly?
Oh, sure, yeah. Lichen sclerosis is an inflammatory skin condition of the vulva, and it's usually
Okay.
a lifelong skin condition. We think there's an autoimmune component to it that possibly, there's a protein in the basement membrane of of your skin layers that your body views as maybe foreign, right? And so then you have these inflammatory markers that come and start to act upon it, and with that becomes the architecture of the vulva changes. So you get a thickening of the skin, right? You can get changes in pigmentation, either hyperpigmentation. And so again, with women of color, that might be confusing to some people. So some people
Sure.
get diagnosed with vitiligo, and it's really lichen sclerosis, right? You just see, oh, there's some pigment changes, must be vitiligo.
Right.
Some patients have both, actually. They might have both. But looking around, what's happening to the labia minora, the smaller lips of the labia can sometimes regress and become smaller. They can also oftentimes disappear totally. And again, with the clitoris, with the skin becoming thick, it can get hid under the hood, and you might not even see the body of the clitoris at all. So that's called clitoral phimosis. And so we think an autoimmune regulated condition where, sometimes patients with other autoimmune conditions, that might be a red flag. It used to be thought that it was more bimodal, where pre-puberty and postmenopausal, you'll get it more. Now, I think it's like we're looking for it more. So I have a lot of 20, 30, 40-year-old patients with it. So I think the geography of it is changing in some capacity as well. And with women of color, because there's so many shapes and sizes and colors that we see, oftentimes, again, there's not enough research done. There's not enough research done on women's sexual health in general, right? But if you compound that with the fact of our, really ugly history when it comes to how we've dealt with, enslaved women in the past, and how women of color particularly have their own, they're sort of have, you have skepticism when it comes to research, when it, if generationally you have had all this happening, then of course, then it's hard to recruit patients for research. But oftentimes there's not even an attempt to recruit them. So if we don't have the research and we don't have the data, I mean, I hate saying it all the time in my office, we just don't have enough research for X, Y, and Z to say one way or another.